Hi, my name is Chris Kaufmann. I'm a surgeon with Strand Surgical Care here in Myrtle Beach. I practice general surgery, surgical critical care, and trauma surgery. The reason I became a doctor goes back to having been a child that was hit by a car, and the doctor that taught me how to tie knots in balloons when he was taking the stitches out of my head I thought was pretty cool. I was in high school and college here in South Carolina, and I was accepted to medical schools both here in South Carolina and the military medical school in Bethesda, Maryland. I decided that I would join the Army and see the world for 20 years, and now 40 years later I've returned where I started to South Carolina. I did my surgery training in Honolulu at Tripler Army Medical Center because somebody has to spend 5 years in Hawaii. And after that, I became a trauma fellow at the University of Washington in Seattle. I was their first trauma fellow. In general surgery, just like in family medicine, we take care of old folks and young folks. We take care of males and females. We take care of surgical problems and non-surgical problems. But we also are clearly the folks who are most well equipped to handle surgical emergencies. And that was what was very appealing to me, to be someone who can provide the broadest care to the broadest number of people. My goals are to treat my patients the way that I would want my family treated. I treat my patients with respect. Communication is always one of the biggest problems in medicine. So I value information from my patients. I want to continue a good chain of communication with them, that way being able to provide them the best possible care. For me, the most rewarding has been trauma care. And one of the reasons is that as trauma surgeons, we try to prevent trauma. So the ability to invest time and resources and commitment to the community to try to minimize the number of car crashes, the number of falls in the elderly, the number of incidents that happen to children, that's very satisfying as a trauma surgeon. The best part of my job is the appreciation that my patients and my family show for the work that I do for them and with them. It's because of that that I keep coming back and enjoy my work every day.